Hello again. Well, today in our health focus, we are talking gut health, something that is so important. While we focus on other parts of our body, we very rarely consider what is going on here, but it is linked to everything else that happens in our body, around our body as well. So we heard from a probiotic and prebiotic expert just a few minutes ago. Well, joining us now from Pretoria is homeopath Dr. Chantell Groenewald to talk about just how they deal, or what the homeopathic view is to actually dealing with our gut health. And Dr. Groenewald, a very good morning to you, and thanks so much for your time this morning. So before we get to the nitty-gritty of it all, what role does homeopathy play in good gut health and dealing and treating gut health?
Good morning. Thank you very much for having me. I think what we need to remember is that when it comes to homeopathy, we want the body to heal itself. And gut health is primary in that, considering that about 70% of your immune system actually sits inside your gut. If your gut is not healthy, your immune system will not be healthy, and your body won't be able to heal itself. So as a homeopath, that's pretty much my first and most important focus when I see a patient, is to make sure that the gut is working optimally, that there's no gut dysbiosis or overgrowth of bad bacteria, and that everything is just basically working optimally.
How do you determine that? How do you actually figure that out for a patient?
Okay, so there's actually a few telltale signs. There's obviously some symptoms that will give you an idea that there's an issue. Apart from obviously concerning symptoms, which would have the patient would need to then seek immediate medical attention. So some symptoms that tells you that there is gut dysbiosis is patients will complain about indigestion, heartburn, bloating after a meal, frequent irritations, flatulence, and then one of the most important things that I always want to know is what a patient's stool looks like. Is it a normal, beautiful S-shaped stool? Is it a floating stool? Do they have constipation or diarrhea, irregular bowel movements? And then obviously on examination, one of the clear signs that there's usually a bit of an issue is when you look at the patient's tongue, they usually have like quite a thick white coating. So all of these things will tell you that the patient probably has a bit of a gut overgrowth. Usually when just in today's normal living, I mean, if you are extremely stressed, which most of us are, that would already predispose you to gut dysbiosis. And then obviously just the way that we eat, any history of chronic use of specific medications, etc. All of these things give you a clue that the patient's gut is not very happy with them at the moment.
Okay, so we're going to have a lot of people looking in their toilet bowls, looking for alphabets, Doc, after this morning show to see if it's an S shape or whatever it is. So let's talk treatment, and you know there are very sort of opposing views when it comes to Western medicine and then other more traditional ways, homeopathy being one of them. You know, just help us navigate that, and what information we could take from both and make it work for us.
Okay, so I think the most important thing to understand is that more Western medication versus complementary therapies, they shouldn't be the one or the other. Complementary therapies is exactly that. The two can usually work very nicely together. To give you an example, if a patient desperately needs an antibiotic with maybe a severe bacterial infection, we're never going to say don't take the antibiotic. Of course you have to take the antibiotic, but we are aware that it is going to cause some issues in your gut. And this is where we want to come in and say, well, let us help basically just kill off any bad bacteria or any overgrowth of bad bacteria. Let's help you heal that gut lining, and let's help you recolonize with the good bacteria afterwards. So in terms of gut health in general, there is obviously we do a very holistic approach. So let's take indigestion as an example. You can go and get an antacid, and maybe tomorrow you'll have heartburn again, and you'll use the antacid again, and the day after, and the day after, and then after a week you realize, okay, but something is wrong here. And this is where your complementary therapy comes in, because we focus on the why. Why do you have indigestion? Not just let's treat it symptomatically, but also let's get to the root cause. Is there an overgrowth of bad bacteria? Is it a food that's not agreeing with you that you should eliminate from your diet? Is it stress-driven or lifestyle-driven or a bad diet? So we want to get to the root cause, and that is pretty much the fundamentals of homeopathy. Is let's get to the root cause of the problem so that we can try and sort that out and heal the patient, from within.
So would your treatment be something that is needed lifelong? Would it be short-term? Would it be stop and start? Because we're often told when you take certain types of medication as well, the body gets used to it. You've got to give it a break now and then. How does it work?
Okay, so I always tell my patients when they come into my office, how long have you had this problem? If they tell me they've had the problem for about 3 years, I say, okay, great, give me about 3 months to sort this out. All right, so that's a generalization, but it's not usually a lifelong thing, because then I haven't healed you. I like to educate my patients. We like to find out what the problem is, and then we need to implement diet and lifestyle changes so that we can reverse the issue and bring about healing. So definitely the diet and lifestyle would be long term. We definitely don't want patients to go back to fast food and processed foods and those types of things. But that is the point, is we want to equip the patient so that they can make the necessary diet and lifestyle changes so that they are healthier and they don't need medicine.
So you mentioned diet, and of course
or
diet,
herbals or homeopathy.
Yes. Doc, you mentioned diet, and we know diet playing, I suppose, the biggest part in all of this, in maintaining good gut health. Tell us what you tell your patients about what they should be eating. You mentioned fast food, yes, and we know, but some of us cave, we can't help those chicken wings on a Friday night at times, and a diet, food, alcohol as well, So just give us some guidelines, give us some tips on how we can live our best gut healthy life.
Okay, all right. So I always try to explain to my patients how the gut works. The gut is basically just the plumbing system. There's basically 2 openings, the mouth and the anus, and there's a tube from the one end to the other end. So this tube has got cells that are bound by what we call tight junctions. And so it's a closed system. We don't want anything from the outside to be able to just readily be absorbed into our, just leak into our body. We want active transport. So the way that I usually explain it is your skin is very similar. Your skin protects you from the outside, the way that your gut or the lumen and the lumen lining protects you on the inside. If I cut myself and I take a sandwich and I rub that sandwich into my skin, what's going to happen? It's going to become very red, it's going to become very inflamed, there's going to be an overgrowth of bad bacteria, the area will become infected, and eventually I will get a systemic infection. And it's very similar inside our gut lumen. You always want the gut lumen and the tight junctions to remain intact, so that the only substances that we eat that can enter the bloodstream is via selective transport. So those tight junctions are basically the policemen, the police gates. And when those get damaged for various reasons, poor lifestyle, poor diet, etc., those gates swing open, and then we start getting what is referred to like a leaky gut or inflammatory, some inflammatory processes inside the gut, and that's what Hippocrates said, or why he said disease begins in the gut. So the reason for this is an overgrowth of bad bacteria, and that's very difficult to reverse unless you are quite strict in your diet and lifestyle. So what I usually explain to my patients is that the food that we eat can contribute towards an overgrowth of bacteria that can then damage those tight junctions. These foods that I usually prefer my patients omit from their diet is obviously any processed foods, any foods with additives and preservatives. I like them to omit, even if it's just for a while, any wheat and gluten-containing products, especially commercially raised dairy and animal products, because they are reared with antibiotics and growth hormones. Commercially reared protein, chicken, meat, etc. Again, because there's a lot of antibiotics usually and growth hormones in the commercially reared livestock. So I want them, and sugar. Obviously, sugar is like the big evil, to feed the wrong types of bacteria. What I do want my patients to eat is an anti-inflammatory type of diet and lifestyle, and a gut healing lifestyle. So what I usually suggest is dairy products, like yogurt, which has got a lot of gut healing bacteria in it, as long as it's free range and grass fed. Because the animal's diet is extremely important in the product that you will be getting and that you will be ingesting. So grass-fed is optimal, and then obviously no routine antibiotics and free range. I want them to eat at least 5 to 7 servings of fruits and vegetables per day. They usually laugh at me when I say this, but the medicine that you need is inside your food. And really, that's the minimum that you should be eating, is at least 7 servings of fruits and vegetables per day, trying to get the color spectrum in there. And of course, for the fiber. Obviously, something like bone broth is making a lot of waves at the moment as being a super gut healing, gut healing food. So that is something that I would recommend you introduce into your diet. And then, I'm leaving out one thing. It'll come to me now, sorry.
It'll come to you. All right. Well, it's fine, because I'm sure that my next guest, or my next 2 guests, are going to actually agree with everything you've said, Dr. Groenewald, when it comes to food and what we should be seeing on our plate and the effects on the colon and the gut as well. So thanks very much for your time. Very, very insightful as well, and very interesting to know. It's the simple things we know that we should do, but either we're lazy or, we're greedy. I don't know what it is, but we tend to sort of just sweep some of the rules aside. So still to come, as we know, as Dr. Groenewald mentioned, a healthy diet means a healthy gut, which in turn creates a healthy immune system. Coming up, dietitian and nutritional coach, as well as a gut expert as well.